Welcome to my channel. At 9 months pregnant, also known as 40 weeks pregnant or 36 to 40 weeks gestation, you're nearing the final stages of your pregnancy journey. This is an exciting time filled with anticipation for the arrival of your baby. In this video, we will cover the various aspects of 9 months pregnant, including common symptoms, fetal development, tips, and what to expect at this stage of your pregnancy. So let's dive right in. If you are seeing me for the first time, please subscribe for more informative content about pregnancy and motherhood. Let's start with the most commonly reported symptom at 9 months of pregnancy, which is swollen feet, ankles, and legs. During the third trimester, it's common to experience swelling in the lower extremities. This is primarily due to increased fluid retention as your body works hard to support the growing baby and prepare for childbirth. Additionally, the pressure exerted by the expanding uterus on the pelvic veins can also contribute to swelling. To find some relief, you might want to try resting with your feet elevated and avoid prolonged standing. These simple measures can help reduce swelling and keep you comfortable. The next symptom on our list is back pain. Back pain is another frequently encountered symptom during the third trimester. The added weight of the baby, the shifting of your center of gravity, and changes in posture can put extra strain on your back muscles. You might find that maintaining good posture, staying active with gentle exercises, and using supportive footwear can help alleviate some of the discomfort. Applying heat or cold packs to the affected area may also provide soothing relief. Next up is frequent urination. As your baby continues to grow and gets into a lower position in your pelvis, it puts pressure on your bladder. This pressure makes it harder for your bladder to hold urine, leading to more frequent urination. It's completely normal to feel like you're constantly running to the bathroom. Just make sure to stay hydrated, but also try to limit your fluid intake a few hours before bedtime to minimize nighttime interruptions. If you're looking for helpful tips on how to deal with frequent urination during pregnancy, check out my video linked here. Another common symptom at 9 months is Braxton Hicks contractions. These are often referred to as false labor contractions. They can feel similar to real contractions, but they don't have the same pattern and they don't get stronger over time. Instead, they tend to come and go randomly. Braxton Hicks contractions are your body's way of preparing for labor. So, while they can be uncomfortable, they are usually harmless. If you do experience these contractions, staying hydrated and changing positions can often help them pass. Next up is stretch marks. Stretch marks may appear on various parts of the body, including the abdomen, breasts, thighs, and buttocks. They occur when the skin is stretched rapidly due to weight gain or hormonal changes. During pregnancy, your skin may lose its elasticity, leading to the formation of stretch marks. While they are not dangerous, they can be a cosmetic concern for some. If you notice stretch marks during pregnancy, know that they will fade over time. Using moisturizers or creams that contain ingredients like hyaluronic acid or cocoa butter may help reduce their appearance. But it's important to note that results are not guaranteed. Another symptom you might encounter is increased vaginal discharge. A slight increase in vaginal discharge is normal during pregnancy, especially during the third trimester. However, if you notice any changes in color, odor, or consistency of the discharge, it's essential to consult your healthcare provider as it could be a sign of infection. Now let's move on to understanding what to expect regarding baby development at 9 months. At this stage, your little one is getting ready for their grand entrance into the world. Their size will vary, but on average, babies born at 9 months measure around 46 to 51 centimeters or 18 to 20 inches long, and they typically weigh between 3.2 and 3.4 kilograms or 7 and 7.5 pounds. Some babies may even be born early, but it's more common after 37 weeks. In terms of position, your baby should be in a head-down position with their head facing down in your pelvis. This is the ideal position for delivery as it allows for a smoother passage through the birth canal. However, if your baby is still in a breech position or other unfavorable position, your doctor may recommend external cephalic version, which involves turning the baby manually from the outside of the uterus. But don't worry, most babies will turn on their own and take that perfect head-down position in time. Your baby's lungs are nearly fully developed at 9 months, and your little one is practicing breathing movements. This is great news because healthy lung development is crucial for their well-being after birth. Speaking of those cute little hands and feet, your baby's reflexes are also nicely coordinated at this stage. They can now blink their eyes, close them tightly, turn their head towards your voice, or touch, grasp objects firmly, and respond to light and sound. Isn't it amazing how much development has occurred in just 9 months? Your baby's skin continues to wrinkle less as fat starts to fill out their body, making them look plumper and ready for snuggles. However, as your baby grows bigger, the room in your womb becomes a bit cramped. Now, this doesn't mean that you won't feel much movement, but rather the type of kicks and jabs might change. Kicks and jabs might become a bit less intense as your baby is getting bigger and has less room to move around. As mentioned earlier, some tips for 9 months of pregnancy include prioritizing rest. Rest is essential during the last month of your pregnancy. Make time for relaxation and self-care. Take naps, read books, or simply lie down and close your eyes. Gentle exercises like walking can also help improve circulation and reduce swelling. Just make sure to consult your doctor before starting any new exercise routine. To understand what to expect at 9 months pregnant, let's talk about what happens if your water breaks. When your water breaks, it means that the amniotic sac has ruptured and the fluid inside has started leaking. You might notice a sudden gush or a slow trickle of clear or slightly yellowish fluid. If your water breaks before labor begins, it's important to pay attention to the color and consistency of the fluid. If it's clear and odorless, it's perfectly normal. However, if it's green, yellow, or bloody, or if you have a strong odor, it's essential to contact your doctor right away. In addition to monitoring your symptoms, continue to attend your prenatal appointments so your care team can monitor both your health and your baby's well-being. They will check your blood pressure, measure your fundal height, and perform other assessments to ensure everything is progressing smoothly. Don't hesitate to ask your healthcare provider any questions you may have. They are there to guide you through this exciting journey. It's also a good idea to start thinking about your birth plan and any necessary preparations. Do you want a natural birth, or would you prefer pain relief options? Are you planning to breastfeed or bottle feed? Discussing these preferences with your partner and healthcare provider can help you make informed decisions and ensure everyone is on the same page. This is the time to pack your hospital bag and gather all the essentials you'll need for yourself and your baby during your hospital stay. Don't forget items like comfortable clothing, toiletries, and any special requests you may have. It's also a good idea to arrange for transportation to and from the hospital. Ensure you have a safe and reliable way to get to the hospital when it's time for delivery. If you are finding this video useful, please hit the like button below and share with friends who may also benefit. See you in the next one.